Hi, my name is Adriana Nottingham. I am the nurse practitioner student, and today I'm going to examine your abdomen. How are you feeling today?
I'm feeling well.
Patient is alert and oriented appropriately. Appearance is clean, well groomed. She is in no signs of acute distress. So I'm going to have you lay on the bed so I can start my exam. All right, I am going to drape your lower part of your body. And I'm going to have you raise your shirt up. So during my exam, I'm going to have you either keep your arms by your side like they are now, or have you cross your chest. And if I need for you to move them elsewhere, I will let you know.
Okay.
All right. So first I am inspecting the abdomen. The abdomen is flat. It is symmetrical. There are no bulges, no visible organs. The skin color is normal within ethnicity. There is a scar from a previous surgery. The umbilicus is rounded or flat. It is midline. There is no inflammation or bulging. Peristalsis is not seen. And the aortic pulsation is seen at the epigastric. So now I am going to take a listen to your 4 quadrants with the diaphragm of my stethoscope. The right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. Bowel sounds are normal active. The gurgling frequency should be between 5 to 34 beats per minute. Now I am going to take a listen to the abdominal arteries with the bell of my stethoscope. First starting at the aorta. The right renal artery. Left renal artery. Left iliac artery. Right iliac artery. Right femoral artery. And the left femoral artery. No bruits were heard over auscultation. Now I am going to percuss in the abdomen, the 4 quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Tympany is heard all throughout the quadrants, which is expected. And I am going to percuss and measure your liver span. So I'm going to start in the right below the right lower quadrant in the midclavicular line, and I'm going to percuss upwards until I go from tympani to dullness. And I'm going to mark on your body, if that is okay, Miss Waters.
Yes.
All right, Miss Waters, I'm gonna have you hold your right breast up for me a little bit more. Thank you. I'm checking for resonance to dullness. Your liver span is about 7 centimeters, which is normal. Normal would be between 6 and 12 centimeters. All right. So now I'm going to percuss your spleen to check for splenomegaly. I'm going to come onto the left side, the left lateral, going right at the 6th rib, going down the left costal margin. Tympani is heard all throughout, which does not indicate splenomegaly, which is good. Now I'm going to palpate, do light palpations on your abdomen first, starting in the right lower quadrant. Right upper quadrant, left upper quadrant, left lower quadrant. Any pain or tenderness?
No.
No pain or tenderness noted. Also did not feel any bulges or masses. Now I'm going to do deep palpation. The right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. Any pain or tenderness?
No.
No pain or tenderness noted. No facial grimacing either. There also were no bulges or masses detected. Now I'm going to palpate the liver edge. I'm going to place my left hand right under the 11th and 12th rib, and I'm going to palpate in the right upper quadrant. Miss Waters, I'm going to have you take a deep breath for me. Breathe out. Another deep breath. Breathe out. Any pain or tenderness?
No.
No pain or tenderness is detected, and the liver's edge is not palpable, which is normal. Now I'm going to palpate the spleen. I'm going to place my left hand under her body, and I'm going to palpate right by the left costal margin, right near the left upper quadrant. you take a deep breath. Again. Any pain or tenderness?
No.
Alrighty. No pain or tenderness is noted, and the spleen is not palpable, which is normal. Now I am going to palpate for the right kidney. So I'm on the right side of the body, and I'm going to place my right hand under her, and I'm going to place my left hand near the right upper quadrant. Have you take a deep breath. And again. Now I'm going to have you breathe out and hold your breath. Again. Any pain or tenderness?
No.
Okay. No pain or tenderness noted. Now I'm going to palpate the left kidney, placing my left hand behind her back and using my right hand to palpate at the left lower quadrant, upper quadrant. Now have you take a deep breath. And again. Have you breathe out and hold your breath. Again. Any pain or tenderness?
No.
All right. No pain or tenderness, also no facial grimacing. Now I am going to assess for rebound tenderness. So I am going to press in your right lower quadrant and release my hand quickly. Any pain?
No.
Great. Now I am going to check for your fluid test for ascites. So I'm going to have you place your hands on your umbilicus. And I'm going to place my left hand on the right side of the body, and I'm going to tap on the left side. No pulsations or movement, so you are negative for ascites. I am now going to check for appendicitis. First, I am going to do the psoas sign. So I am going to have you flex your hip, bend your knee, and I'm going to have you lift your leg, resisting against my hand. All right. Any pain in your abdomen?
No.
Great. Now I'm going to have you turn on the left side. And I'm going to raise this, and I'm going to extend. Any pain or tenderness?
No.
Great. You can lay back on your back. So the psoas sign is negative for appendicitis. Now I'm going to do the obturator sign. So I am going to have you bend your leg up again, and I'm going to internally rotate. Any pain or tenderness in your abdomen?
No.
Great. Negative for obturator sign. And now I'm going to test for the Rovsing sign. I'm going to gently palpate into your left lower quadrant and quickly release. Did you have any pain here?
No.
No pain felt in the right lower quadrant, which is negative for Rovsing sign. Now I'm going to check for, I'm going to check for your Murphy sign. Make sure you don't have cholecystitis or gallbladder infection. So first, I'm going to palpate to find the liver's edge again. I'm going to have you take a deep breath, and when you do take a deep breath, I'm going to push kind of deep into your abdomen, okay?
Okay.
All right, deep breath. Breathe out. Any pain?
No.
All right, let's try one more time. Deep breath. Any pain?
No.
All right. No pain or tenderness. Also no facial grimacing for pain. So you are negative for cholecystitis. And I'm going to have you sit up, and I'm going to check for coastal vertebral angle. Make sure you don't have any tenderness in your kidneys. I'm going to have you turn this way. Perfect. Now I'm going to bang on your back gently, and you just let me know if you feel any pain or tenderness using the ball of my hand. Any pain or tenderness?
No.
Great. So Miss Waters, your exam went well. If you start to develop any type of pain or need to come back, you are welcome to come back. Thank you for allowing me to examine you.
Thank you.